Hello, my name is Sass. I'm a nurse practitioner at Peacock Pediatrics, and today I'm going to talk to you guys about the 3-year-old and the 3-year-old well visit. So 3 years old is a really fun age. These kiddos are really independent and they're learning things so quickly, and so we want you to be prepared and kind of helping them keep on track developmentally and get ready, because in a couple of years they'll go to school. So first we're going to talk about reading with your child, singing songs, playing games, all very, very important for their social skills and their language skills. And those are things we want you to be doing every single day with them. Making sure they're not getting a lot of screen time. So really an hour a day max. The rest of the time they should be playing with toys and reading books and going outside and interacting with other children. At age 3, we would expect them to be able to climb stairs, alternating their feet, riding a tricycle or pedaling the tricycle, running pretty effortlessly, holding a pencil and drawing circles, turning a page of a book. At this age, they should have about 300 words, and about 75% of those words I should be able to understand. So as an outsider kind of coming in, it's not with them every day, it's not a parent, I want to be able to understand about 3/4 of the words they're saying. And their vocabulary over the course of this next year is going to grow exponentially, so we want you to be talking to your child and really encouraging those language skills. So at this age, we also want you to be encouraging your child to make choices. So, maybe having them pick their clothes out for the day, and, giving them 2 options of a vegetable to have at dinner time, offering them a huge variety of foods. At this age, we kind of see kids being classified as like picky eaters, and we want you to keep introducing those foods. If a 3-year-old says they don't want something one day, then tomorrow it's their very favorite food and they want it for every meal. So just keep offering it, keep giving them a variety, giving them a little bit of an autonomy, but also putting it on their plate and encouraging them to eat it. It's also very important at this age to reinforce good behavior and kind of ignore bad behavior. So if it's obviously something unsafe, we don't need to step in and be like, no, we don't do that, that's unsafe. But if it's not, kind of ignoring the behavior, because kids sometimes want just any type of attention, even if it's negative. So really focusing on the good things they're doing and giving them attention for those things. Safety-wise, we want them, depending on their weight and height, they may have outgrown the convertible car seat rear facing, so they should be for sure rear facing until age 2, and then if they've grown out of the height and weight requirement, they can turn forward facing, but still need to be in a safe car seat. Never leaving the child alone in the car, even if it's for a short amount of time. If there is a gun in the house, it needs to be in a safe with ammunition stored separately. Not leaving any water in the bathtub or pools and leaving the child alone, making sure they kind of understand, or not to go near a pool without an adult, but even then supervision is key. When they're done taking a bath, unplugging the bath water is super important and should just be kind of a habit. Making sure your child is able to interact with kids their age, and potty training is something we also get asked a lot about at this visit, and your child should show interest in potty training. It is much, much easier for the parent and the child if they are showing an interest in wanting to go to the bathroom before you kind of start the potty training. It's almost impossible to force a kid to potty train before they're ready, and it kind of is a headache on both the parent and the child's end if they're not. If you have any questions or concern about your 3-year-old, you can absolutely bring it up at your well child check or just call and make an appointment. We'd be happy to see you. If you guys need anything, just let us know.